Well, this week is Black Maternal Health Week here in the U.S. The goal is to bring awareness to disparities in minority communities around maternal and infant health. Listen to this number. Black women are nearly 3 times more likely to die from pregnancy-related causes compared to white women. Congresswoman Robin Kelly is joining me now live to talk about Maternal Health Week and her efforts to pass new legislation in Congress. It is nice to see you. Hello to you.
Nice to see you, and thanks for having me.
Okay, of course. The part of the story that really stunned me the most is that things aren't necessarily getting better. And in fact, from 2019 to 2021, maternal mortality rose by 60%. So how do you even begin to tackle this issue?
Well, we have pieces of legislation that we've filed for a few Congresses now. We had some successes last Congress with, Medicaid only covered for 60 days, but in now 32 states, it'll cover for the postpartum period for a whole year. And that was deemed very, very important by OBGYN. So we were able to get that accomplished, but we wanted to be for all 50 states. But there's 32 now, and we hear there's a couple of more states looking at extension. So that will help. Access to health care will help. It's very tough in some of the areas where hospitals are shutting down, and that's an urban, suburban, and rural problem. And then uplifting doulas and midwives to enhance the birthing experience will help greatly. And then I also think that different training or more inclusive training when doctors are trained and nurses are trained, because there shows a need for culturally competent care.
Yeah, it sounds like it's really a continuing effort that will go on for years. But it's not just about the hospitals and the healthcare system. Maternal health also means that women need access to time off to go to some of their, doctor's appointments when they're pregnant. Also, better transportation. Are those factors that are being addressed in the legislation and some of the things that are coming up?
Well, in my legislation, no, that's not a part of it. But what you're saying is true. It's really the social determinants of health, that you're talking about with transportation and people being allowed to take off from their jobs. But also the other part of it is telehealth, which really was expanded during COVID, but it's very, very important when it comes to even pregnant women. I know OB-GYNs I spoke to, they said that they're using it more, of course, not to deliver the baby, but for other parts of pregnancy.
Okay. There's people watching at home that would say, I want to help bring awareness to this issue. What can somebody who's watching at home do to maybe help?
I would say you can invite people like me. You can invite other healthcare professionals, whether nurses, doctors, doulas, midwives, into your circle, whether that's, a group you're a part of, a sorority, a fraternity, a church group, to really build awareness. And then the other important part of it is that we need to advocate for ourselves. We need to speak up. We need to challenge where necessary. We need to ask questions. We have to really be our own best advocates.
All right, Congresswoman Robin Kelly, we appreciate your time. Thank you for joining us this afternoon.
Thank you.